Good afternoon, ladies and gentlemen. Thank you all for joining me on this edition of the program You and Your Health aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. There is an outbreak of monkeypox in the Southwest region. The information was revealed by the Southwest Regional Delegate for Public Health, Dr. Eko Philbert. In the release, he writes that 2 positive cases have been registered in that part of Cameroon. In the course of this program, we will tell you how this disease can spread and how we can better prevent ourselves from being victims. But that will be done shortly. On the line is Dr. Ako Chanel Carroll, a medical practitioner at the Bingo Baptist Hospital. Good day, doctor. It is a pleasure having you on the program.
It's always a pleasure having you.
So, doctor, there is an outbreak of monkeypox in the Southwest region. What is monkeypox all about?
Yeah. Monkeypox actually it's a disease which we actually call them zoonotic, where we get them from animals, like animal to human transmission, and it's actually not a new disease because it's been there for more than 52 years now, because the first time people really got to talk about monkeypox was right in 1970. So it's something not really new and something especially not new to Africa, maybe to Cameroon, but not to Africa as a whole, because initially its origin has always been traced back to West and Central Africa in the Democratic Republic of Congo, in Nigeria. So it's actually a disease which presents itself mostly as a rash, which is quite similar to smallpox. So people actually believe, because smallpox was once upon a time a pandemic where people had to struggle, get vaccinated for it to be eradicated, and people still feel like it's a kind of a mutation from smallpox that the world is experiencing right now.
So now you talked about transmission through animals. Are there particular animals that can transmit this disease?
Yes, they are. For example, the porcupine, what most of our bushmeats we have, meat we have, like porcupine, dogs, the chimpanzees. So those are common animals that harbor this virus, which the humans can get.
So now, apart from the rashes you talked about, what are other symptoms of monkeypox?
Like many other viral infections, it presents mostly with high temperatures, what we call the prodromal period. Actually, the rashes actually comes later than these prodromal symptoms. So you have like fever, you have vomiting, you have nausea, you have enlarged nodes, lymph nodes at the level of the chin or even the inguinal regions before this patient starts presenting with the rash. So before a patient presents with a rash, know that the prodromal period has been there for up to 10 to 12 days before you start manifesting with the rash.
Okay, and now, how is it transmitted from one person to the other?
Sorry?
How can it be transmitted?
Well, like what we earlier said, it's easily transmissible from animals to humans, and to a lesser extent now, people also feel, or that they have come to know, to understand that human-to-human transmission is also possible. So you have eating poorly cooked meat, or having pets which are infected with the viruses, or being in contact with someone recently diagnosed or suffering from the monkeypox virus.
Now that there is an outbreak, now that there is an outbreak in the Southwest region, how worried should we be?
Well, I think first, it's good we know, and secondly, it's also good we are aware that although it's everywhere, we shouldn't be so scared, that because most of the manifestations of monkeypox are not as severe as the manifestations of smallpox. So it's majority of the patients will present with moderate to mild symptoms. The mortality rate, especially for us in Africa, is like 1:10%. So it's first, it's good we know, and we are able to take directions towards its prevention and control, so that we shouldn't panic. Like, oh, there is this virus, we are panicking, oh, everybody's shaking and all whatnot. There is an opportunity for us to take a stand, so we are able to halt the progression of the virus to the rest of Cameroon as a whole.
And let's talk about, can condoms equally prevent transmission?
Yes, condom actually prevents it, because, like I earlier said, we are still to come to terms of how the transmission from human to human is. But so far, WHO, the World Health Organization, has taken into place to tell people that after the prevention, because we can fight the virus in human semen and vagina, so it encourages people to have consistent use of condoms within the first 12 weeks, even after the infection of the virus. So it means the condom, the barrier as a barrier method in contact with the virus. It's also worth noting that it doesn't reduce all the risk of infection, since the virus can manifest in many other parts. So you can only wear the condom if you want to protect the penis, the vagina, the oral mucosa from these things. But in other aspects where the bodies are exposed, condom has a limited preventive method towards it. But yes,
okay. Let's now take a case like in the southwest region where we have two cases. Let's say those living around such victims, what are some tips they need to respect in order not to become a victim of such a disease?
One of the things we would like to encourage, especially at the levels of the community, because now most of it is prevention and the prevention methods and control. That's what the infection prevention and control methods. So first, at the level of the communities, we have to educate people about this virus. We have to let them know it's not a form of witchcraft that is being poured in the community. So we educate people to be able to identify them whenever they see them. And secondly, we have to work on our hygiene, be it the minimal hand washing, the minimal water they get in contact with. And then thirdly, I think mostly it's going to be that, and with the animals, in contact with animals. I know this particular part of Cameroon, or this particular, everywhere among us, we eat a lot of bushmeat. So when you want to go, you find them there. So it's quite difficult to tell these people, hey, the porcupine you're about to sell, are you sure it's well cooked? So we have to ensure that the meat people are cooking, it's properly cooked in order to destroy the virus. So I think that's all we can tell the community.
Okay, in case you realize you're suffering with this, what is the first step you're supposed to do or take? What step?
Sorry?
In case you notice that you're suffering with chickenpox, what should be your first step? Should you go straight to the hospital, or you can start taking some medications? If medications, what type of medications then?
Well, the first thing is to seek hospital care, because now it's a disease under surveillance, meaning the hospitals, the communities are supposed to be aware. That doesn't mean you're afraid that you're going to die. I think it's just giving you a very rapid contact with a healthcare personnel, so the treatment is initiated immediately. And most of the initial care that is given is mostly symptomatic. Like I said, it's a virus, and quite often it is self-limiting, meaning between the second week to about a month or 6 weeks later, the infection will disappear on its own, even if you don't take treatment. But then for those who are at high risk of having a severe form of the disease, then they have medications, antiviral medications, which they give them. But for the milder symptoms, in case of fever, you just give antipyretics to lower the temperature. In case of maybe they have pharyngitis, that's a sore throat, you're trying to make them comfortable, to give them painkillers to help them get better. Or if it's a super infection, meaning you have the skin rash that is there, then you have another bacteria which comes and super infects this thing, then you go in and start giving them maybe antibiotics. So most of the time, if they are vomiting as well, they are not sure to try to hydrate them so they don't get dehydrated. I think that's basically what they do for now. Then the severe form, you take them, maybe they are being hospitalized for better care.
Thank you so much, Doctor. That was Dr. Ako Carol Chinel, a medical practitioner at the Bingo Baptist Hospital. Thank you, ladies and gentlemen, for your time. Have a lovely day. So long.